What's up guys, Dr. Rossi, shrinksandsneakers.com. So every year I tell junior residents and medical students don't bother doing a fellowship in psychiatry. And every year there's a few that don't listen. So let's talk a little bit about why I think these psychiatric fellowships are not really worth the extra time that you're committing to it, and some of the downsides that you might not be aware of associated with completing more training in the field of psychiatry. So first thing I'm going to say is that not all fellowships are created equally. So if you're going to choose to commit your time, energy, and money to an additional year or two of training, you better be sure that whatever it is that you're doing is going to offer you a skill or provide you with a skill set that nobody else has. So let's take a couple of examples. Let's say you decide you want to do a bipolar fellowship at Harvard University. Now, that sounds great, right? Harvard University, you get a fellowship certificate at the end that says you went to Harvard, you can tell all your friends and family. But the question is, does that fellowship make you any better at treating bipolar disorder than somebody who chooses to read about bipolar disorder, learn about bipolar disorder, possibly attend a conference on, that's dedicated to bipolar disorder, and is clinically treating bipolar patients on a regular basis? Is that fellowship going to make you any better? I think the answer is no. Honestly, I think someone who reads and applies information, somebody who is constantly learning and growing and trying to get better as a clinician, is going to be just as good as the person who completes that fellowship in bipolar disorder from Harvard. Now, the same thing goes for some of the other fellowships in psychiatry as well. So some of the fellowships, including forensic work, a lot of times, yes, it's nice to be boarded in forensics, but you can often get forensic work as a general psychiatrist who's board certified. Because essentially what the courts are looking for, what lawyers are looking for, is someone who can act as an expert in psychiatry. They're not necessarily looking for someone who understands all of the law aspects. They're looking for an expert to testify on the psychiatric disorders or the psychiatric problems that that potential person is having, and to give that objective evaluation. Now, are some fellowships worth it? Yes. Let's look at a different specialty. Let's look, for example, at cardiology, right? So let's say you do an internal medicine residency and you decide that after completing internal medicine residency that that's not enough. You really want to be an interventional cardiologist. Well, why is that more valuable than, say, a forensics fellowship or addiction fellowship or a psychosomatic or something type of fellowship, right? The reason being is when that person graduates fellowship as an interventional cardiologist, they literally have a skill set that, again, no one else is going to have, or very few people are going to have. They're going to be able to do things that most other cardiologists and medical doctors aren't necessarily doing. So this provides a lot of value in terms of what it can offer not only the patients in terms of care, but also to you as the clinician in terms of career fulfillment and, of course, potential income. In the end, some of this stuff always comes back to money, especially if you're thinking about how you're going to pay those student loans off. So people say to me, Dr. Rossi, well, what about the training? Like, how could I ever do addiction medicine or addiction psychiatry without getting this fellowship training, right? How can I do that? Well, I think you need to go back and look at the situation like this. Is the person who does a one-year fellowship, again, any better than someone who chooses to take a job as a psychiatrist at a drug and alcohol rehabilitation center? I would actually argue to you guys that the person who chooses to go to the drug and alcohol rehabilitation center and takes a job is actually might even be a little bit better than the person who does the fellowship. And you may say to me, well, why is that? How could that be, right? How could it be that that person could be better? Well, let's look at it. The thing about fellowship is you're still a trainee, right? You're not completely assuming responsibility for the patient. You still are signing your notes to an attending. You're still discussing your cases with an attending before you make decisions. You don't take full ownership of that patient. With that said, that limits the amount of actual education you're really getting, right? And the reason I say that is because, again, you're always falling back on that attending. There's always someone to cover your behind. You're not taking the full responsibility and ownership of caring for that patient and doing what you think would be the right thing. So you may have one idea, but your attending may tell you, no, I don't like that idea, let's do something else, right? And then you ultimately have to go along with whatever that attending physician wants to do. So you never really get to take full ownership or control over the patients that you're seeing. So I waited to the end to discuss this last point, and that is money, right? Because at the end of the day, it all comes down to money, right? We have to talk about it. It's part of life. It's essential for us to get through our lives and our days to have some kind of income and source of income. So let's talk about the money costs of doing fellowship. Residency salaries and fellowship salaries are generally based on the region in which you're practicing. So there's sort of a standard kind of amount. There's a little bit of a range, so it will vary. But let's just put it this way. The Northeast gets paid a certain amount of money, right, as residents. And that is going to be similar amongst the different residencies in the Northeast. So if you're in New York, if you're in New Jersey, if you're in Massachusetts, etc., you are going to kind of get paid a similar salary to other residents in that area. Sometimes the city programs, like say New York City, are going to pay a little bit more because, again, the cost of living is so high. So that's why they kind of regionally base it. They base it off of the cost of living and sort of the area in which you're going to be a resident. And the same thing for fellows. And the salary tends to be very low. I mean, in most cases, the salary is lower than what your average nurse is making at a particular hospital, and certainly much lower than what nurse practitioners and PAs are doing, even though in reality, a resident is doing a very similar job to what, a nurse practitioner or PA is doing at that level of training. So the pay is relatively low. Now you're sacrificing 1 to 2 years of your life to do this fellowship. So most fellowships in psychiatry are only a single year. However, child adolescent psychiatry is 2 years, and you can fast track in your 3rd year. So if you decide to complete your 3rd year and then fast track the child, that's good because it only equates to 1 additional year of training over what the normal psychiatry residency would be. But still, it's another year of your life, and it's another year of earning far less money than you're potentially capable of earning. Now, does that hurt you? Well, I think as a resident or as a medical student, someone who's gone through medical school, has paid all this money, likely had to take loans out in order to support themselves during a portion of that training, it could hurt you greatly, right? Majority of your friends who chose to do other things, well, they're already putting money into their retirements. They're already buying homes and starting families. You may be delaying a lot of those things for the sake of training. So you better be sure that if you're going to delay some of those major life events that you're going to want to have, as well as, stop incurring so much interest and money on your student loans, then you're going to want to get out there and practice in your full capacity as an attending physician. So you definitely have the risk of losing having financial risks associated with doing additional training. And again, you better be sure that if you're going to do that training, it's going to get you a skill set that nobody else in psychiatry has. With all of those things said, I'm going to conclude this video by just saying which of the fellowships I think have some value if you're going to do one. So my number 1 choice at the top is child adolescent psychiatry, because it's very hard to work with children unless you have the fellowship training and board certification. Now, can you work with adolescents? Yes, a lot of places do allow general psychiatrists, someone who's just boarded in psychiatry and neurology, to be able to work with patients who are adolescents, say like 15, 16-year-old kids up to like 18. But that depends and will vary by laws and regulations and hospital systems and what they see, and actually also availability of psychiatrists. It's often very difficult to find child adolescent psychiatrists in certain more rural parts of the United States. So that's another place where you might be, that's one place where you might be able to carve out a little bit of a niche for yourself. However, more recently, those people with board certification in child are making about the same amount of salary as people who are just general psychiatrists. So there's not a whole lot of difference these days in terms of salary. The other potential place I could see doing a fellowship would be addiction medicine or addiction psychiatry, and that is just because, as most of you probably know, we have an opioid epidemic here in the United States, and we need as many addiction psychiatrists as we can get. And recently, ASAM has decided to put a final date on when you can get your pathway to practice board certification. So there's two different ways. You can either do a fellowship for 1 year, or you can practice in the field of addiction medicine, and you can incur a number of hours. You have to have a mentor, you have to have certain things signed off and meet certain requirements. But when you meet those requirements of the hours, have the mentor, have demonstrated essentially the skills, you will then be provided the opportunity to sit for the board exam. So there was a pathway to practice addiction medicine, which is still open as of now, but they're looking to kind of close that down over the next several years and make it pretty much mandatory that a person who wants to do addiction medicine get a degree, get a fellowship and be board certified through the fellowship versus through the path of practice. So those are the two that come to mind for me as potential areas where if you were to do it, it could provide some upside and could be beneficial. But again, for like addiction medicine, I think the skill sets of using buprenorphine, the skill sets of using naltrexone or disulfiram or any of these medications can be easily learned about and understood without necessarily doing a full fellowship in those areas. So that concludes the video. If you have any questions, comments about fellowship, or thoughts of your own about why fellowship might be a good thing to do, I'd love to hear them. Leave them in the comment section below. And please like and subscribe to the videos. More content coming soon.